tells you, is that all, you miss something. They cannot fail you up to ABCs. You can start over as many times as you want, but the time doesn't stop. So if you're going, my scene size is this, on my primary server, this is this. Once you get to ABCs, you can always start over. After you get to ABCs, from that point forward, you cannot go back and start over. Okay? That's a new change. Other things with patient assessment, time, usually is the culprit here. Make sure you allot yourself enough time to get to the vitals, do the vitals, and get through it. Understand, OP, QRST has to be in order. ABCs have to be in order. Sample has to be in order. You cannot ask someone about the medical history, go back to science and scissors, ask them the allergies, what did you add last week, and then what's your pertinent medical history. It's in order for a reason. Okay? So, patient assessment, you got all those. Time, get to ABCs, you start over. Once you get to ABCs, you cannot. OP, QRST, ABCs, sample, all in order. Your ring down, this is where you have your piece of tape. Your ring down, if you have a pen, you can write down every single thing once the exam begins, as you're getting that information. Patient states, mowing lawn, provocation, phone, rain, radiation, severity, all that stuff you write down, you can write down your vitals. Because when you do your ring down, you can actually take that piece of tape off. I have a third-shield female complaining of difficulty breathing. Patient states this. I put on 15 liters non-breather, this. We'll see you in 5 minutes unless you have any sort of question. Remember, patient assessment, you have to do a ring down. Okay? Any questions on patient assessment? What you will fail? Trauma. Trauma, same kind of rules apply. You need to watch. When you get to the point where you ask the patient, the proctor, do I have any life-threatening bleeding emergencies? They will indicate yes. You'll have to address that life-threatening bleeding emergency right then and there. When you get to the lower extremities, at the end of your skill, you assume that that injury no longer exists. You palpate accordingly, log roll accordingly, as if the left-sided exposed femur fracture did not exist. Once you address it, it's over with. Remember, you cannot address a finding. You have to assess, then you're going to get a finding. So when you're doing the head, for example, you're looking in the ears for blood, cerebral spinal fluid, you're looking in the nose for the same. You look at the eyes for pearl, they won't say anything because you can't assess a finding. You look at the eyes for reactivity, they will tell you the eyes are pearl. When you look at the neck, you're looking for jugular vein distension, and you cannot find, or you can't assess flat neck vein. That's a finding. So you assess jugular vein distension and JVD, you will find that you have flat neck vein. So understand that. Vitals. You still have to allow for vitals in there as well. You still have to also acknowledge sample. Even though you're not going to get sample, you have to say at this point of the skill, I would try to get my sample history, but due to the fact my patient's unresponsive, no sample can be given at this point. Can you still do OPQRST? Sure, why not? Patient hit a tree, yeah. You're not going to get a chief complaint. You may get severity. I mean, I don't know. Are we doing OPQRST on that, on trauma? Or are we just going to sample, right?
Sample.
Okay. So OPQRST is going to be assumed. Never mind that. Just sample needs to be addressed. At least mentioned. Okay? Other things. BVM. If the proctor can determine that your EC clamp is not sufficient, you can alternatively do your other hand. Ideally, you want to be above the head, and this is a trick that we didn't tell anybody else. You can be above the head, holding it with one hand with the head chin lift, and do the BVM. The proctor has to tell you another patient is another proctor is on board, and then you give it back to them, and then you maintain the EC clamp however you can. Okay, some of you have smaller hands. Maria, where's she? Okay, she has very small hands. She may have to borrow someone's hand. I don't know, but you could do whatever you have to do to get that clamp for the face to mask seal. Good. So once the bag is handed off, you put both hands on the mask and hold it in place, and let that person do the ventilations. You have to instruct the person to do the ventilations. What are you going to say at the ventilations? Adequate ventilations, at least 6 to 12 a minute, right? Or 12 to 20 a minute. Well, 15 liters of oxygen is in there, but at least 800 milliliters of volume, right?
Do we have to have somebody do
Well, they're going to tell you another proctor is available, and you're going to actually have him do the ventilation like you hold the face mask.
You have to use them? You have, are we gonna, do we have to use another proctor?
No, you don't. No. No, I want to answer your question.
I was thinking that we didn't have to have another.
No, you just say. All right, on AD, if you do not at least gesture the chest open with the shirt, you're going to fail. You have to get the proctor's attention. I'm going to go ahead and expose the patient's chest. Do this before you actually put the pads on. The pads have pictures on them. If you invert them, they're going to fail you. The pictures are there for a reason. Unless you understand clearly what monophasic and biphasic and bipolar phasic, not the disease. Unless you understand monophasic, then don't worry about the pads have to go in those spots for a reason. They put the pictures on there for you to put them in the right places. So if you know enough about it and you can justify switching them, then I want to talk to you about it. If you can't explain it to me, then you're going to fail. Okay? They have to go in the right spot. You have to gesture the shirt open. You're not actually going to do it. You just gesture it. The thing with BVM and cardiac, it's interactive. The proctor has to prompt you on certain stages of that skill, so it should be an interactive process that you, as long as you read it, you know what the proctor has to ask you, and the proctors know what they have to ask. All right, the last one was what you just did, longboard or KED. KED, if you pull the straps without asking if they can breathe, you will fail. If you pull the strap so hard as the KED turns, you will fail. If the KED is low in the axia, you will fail. So how do you avoid that? You have your patient lift their arms, get that KED up high into the axia, shove them, put their arms down, and then lean them back. That's the easiest way to do it. What else? You have to reassess 4 times on the KED. One of them is going to be verbal. You have to assess 3 times on the longboard. You cannot step over your patient at all on the longboard whatsoever. I would make it very dramatic and walk around. Every time you add something to the patient, make sure you reassess. These are all automatic fails. The random, Sager or hair. You guys know how to do that process. This is why we're going to be here until 9 o'clock doing that process. Once again, any questions on any of those skills? That's kind of it. Any questions? Now's the time to ask, because on next Wednesday, I'm not going to be answering any questions at all. Hey, Eric, when I do this, I'm not doing that on the final. So now's the time. If you don't have them now, before 9 o'clock, make sure you come in and address them. I need to know what this is. You can't urge it up. 6 o'clock, between those last doors on this side, I'm shutting them. And I may actually pull everyone in there and shut the white doors as well. Get your sheets ready, have them signed, and hold on to them. Then it's what you guys back out. So please, if you guys have any problem getting here on time, I suggest you either stay the night Tuesday or... Yes. Okay, I'll leave it that. On retest. You have 5 core skills in 1 random. If you fail 1 of the core skills, don't worry about it. You fail 2 of the core skills. Say, for instance, you fail the first one, and you get past the other ones, and you fail the 5th one. However you fail that second one, I will remediate 1 of those 2. I personally will have to do that for the National Registry. If you fail 1 of those 2, you're done. Okay? Because that means that you failed at least 3 times out of 5. That's not a good percentage, especially if one of them's the same one. Because if you pass patient assessment medical, patient assessment trauma, you pass AED, you fail BVM, and you fail extrication. Say for instance you fail extrication 10, I will retest you on extrication longboard. I'll take the harder of the 2 that you failed. I won't take BVM. Understand that. Sager, that's a pass or fail. If you fail that one, that will count against you over here. So if you pass all 4 of them, fell here and fell here, it's still going to count as 2. I will retest you on Sager or here, depending on which one you fail. So if you get bunched up and you fail 2, and you pass everything else, I'll come back to you and say, okay, we're going to retest you on this one. You know, generally I'll be doing the testing. If I get kind of convoluted with everything, someone else may do that. So if you fail 3 out of the 5, just do this, 3 out of the 5. Just keep waving to yourself. There's really no point. I mean, I'm being kind of sarcastic. There's really no point in going on. If you can't pass 3 of the 5 skills, the National Registry gives you a 70% pass. That's an F. I don't want you on the street. I mean, you have to be patient, but I don't want you responding to anything. Okay? Understand? That's just being fair. Okay, so what time are you guys going to be here? 5:45? 5:30? No? Okay, if you have individual questions, we have until 9 o'clock. We're still out here at 9. Anything else? Okay. That's it.